Here's a story you may not have heard before. An astronaut, a cervical spine surgery, and one of the most important space missions in the history of mankind. Yes, we are talking about none other than Michael Collins. Hello everyone, I'm Dr. Adita Raj, an orthopedic spine surgeon working with Synapse Spine. Michael Collins was initially chosen to be a part of the Apollo 8 mission. However, during training, he experienced some neck pain going down his arms along with symptoms of cervical myelopathy. Therefore, he could not be a part of this Apollo 8 mission and had to undergo treatment for this cervical spine issue. He finally underwent a surgical decompression and fusion at the cervical spine. Despite the fact that he underwent a cervical spine fusion, he was chosen to be a part of the great Apollo 11 mission, the first mission which took humankind to Moon. He was one of the 3 successful members who were able to complete this mission alongside Buzz Aldrin and Neil Armstrong. This emphasizes an important fact that undergoing a cervical spine fusion will not restrict you from carrying out your other professional activities. We do treat patients the similar way by subjecting them through a cervical spine fusion for majority of the conditions like cervical disc herniations, cervical myelopathy, and cervical radiculopathy. However, with time, both the technique and precision of this procedure have improved. Now we do these procedures under microscopic guidance and monitoring through something called as intraoperative neuromonitoring. Through intraoperative neuromonitoring, we ensure that the spinal cord function is optimal all throughout the procedure and patient has maximum recovery. However, we do have motion-preserving alternatives to cervical spine fusion now. These consist of a cervical disc replacement or something called as a cervical laminoplasty. These procedures are preferred for younger patients where fusion of multiple levels in the cervical spine may not be the best possible choice. However, all candidates are not suitable to undergo these kinds of motion-preserving cervical spine surgery. If you have been advised cervical spine surgery, make sure you visit an expert to understand all possible options and make an informed decision. Thank you.